Ding, ding, ding. Class is in session. Get in here. Get in here with your paper and pencil, pad, and style it. Today, we will be breaking down drugs used to treat nervous system disorders. But before we start, let me introduce myself. They call me Ms. Rose. And if you are new to the channel, welcome. Thank you for supporting this channel, and I hope you find value. If you have been here before, thank you again for your continued support. All right, let's get started. Okay, now let's look at some beta adrenergic blockers, cholinergics, and anticholinergics. Alpha and beta adrenergic blocking agents. This is the stimulation of alpha-1 catecholamine receptors. They constrict blood vessels. And if there's constricting blood vessels, what's going to happen? Remember what I always say. If you know how the body works, you'll know how to treat it. What does constricting blood vessels result? What is the result of constricting blood vessels? Increased blood pressure. Very good. Now, alpha blockers, these are used with diseases associated with vasoconstriction. Beta blockers are used extensively to treat hypertension. Now, to remember beta blocker, remember, let me get my pen. Beta blockers end in, that's not my pen, is this my pen? Yes, LOL. They end in LOL, okay? So, what are the actions of these drugs? To block alpha or beta receptors. So, if it's an alpha adrenergic blocking agent or a beta adrenergic blocking agent, it's going to block alpha or beta receptors. Remember, this is how the drug gets around, do its thing. Uses to treat hypertension. Almost exclusively, this drug is used to treat hypertension. Let's see what else. They do use like metoprolol to treat like a tachycardia, depending on the cause of the tachycardia. Common adverse effects of these drugs is for diabetic patients, hypoglycemia symptoms may be masked. What does that mean? You won't be able to tell that their blood sugar is low because the drug is masking that, so you won't be able to see it. Okay, so like if I'm smiling and I have on a mask, you can't tell that I'm smiling. So if I'm hypoglycemic and I'm taking this drug, you won't know that my blood sugar is low. I won't have the regular symptoms. Serious adverse effects are bradycardia, peripheral vasoconstriction, heart failure, bronchospasm, and wheezing. Okay? So, those are serious adverse effects, and those are the ones that the nurse should be concerned, that will cause the nurse concern. The nurse should be concerned about those, and probably, more than likely, notifying the physician, or in our PN case, notifying the registered nurse. Okay, so when alpha-1 receptors are stimulated, blood vessels get tighter or they constrict. And this is going to make the blood pressure go up, right? You got smaller diameter, more blood to pump through, pressure is going to go up. Alpha blockers help relax these blood vessels. So they're used for conditions where the blood vessels are too tight. We want to open them up a little bit, right? Beta blockers are often used to lower high blood pressure, almost exclusively, like we said earlier. So let's look at our beta adrenergic blocking agents. They're used to treat hypertension, angina pectoris, that chest pain that you get from not having enough oxygen in that area, cardiac dysrhythmias, and hyperthyroidism. Some examples of a beta adrenergic blocking agents are your atenolol. You see the LOL on the end? Atenolol, which is tenormin. Carvedilol, which is Coreg. And metoprolol, which is your Lopressor, or Toprol XL, extra strength. So all end in LOL. These are your beta blockers. Okay, we got a question. A patient who has recently experienced a heart attack is prescribed a beta-adrenergic blocking agent. Which symptom of this therapy would be of concern to the nurse? Okay, there's that word we were talking about earlier. Concern of the nurse. What do you think? All right, which one did you choose? Let me see. Oh, a couple of you got it right. Okay, the answer is a decrease in heart rate from 88 beats per minute to 46 beats per minute. Now, even if you didn't know the answer or nothing about the particular class of medication, you just forgot everything about beta-adrenergic blocking agents or whatever. You know that 46 beats per minute is abnormal. What is the normal heart rate? 60 to 100. So a heart rate of 46 should be concerning to the nurse. If it wasn't, if you didn't pick it, then I'm sorry to say you're not a safe practitioner, and I need you to go back to your fundamentals book and study the normal values for vital signs. If you get a question on your exam or you're sitting for your boards and you can't pull out the normal vital signs, you'll have a problem. You're not going to be happy. All right, so thank you for watching the channel. If you like the content, please hit the like button. And to be sure you don't miss any new content, go ahead and subscribe. And feel free to share. Share this with your study buddy. I'm here for you. There's no products, there's no merch, just me breaking it down.